Trailblazing families and world schoolers, welcome. We are doing a live today with a really cool digital nomad dad and world schooler, Neville Mehra, and he is the co-founder and chief marketing officer of Genki, which is a travel insurance company. They do lots of other things. So my notes, there you go. All right, so let me introduce you to Neville a little bit. As I mentioned, he's a digital nomad for a while, and now he's a dad, so I want to hear about that. And he helped launch Genki Health for Nomads. He has many years of experience working in the marketing and technology sectors, and he's been an advocate for the digital nomad lifestyle for years. And again, he's now a dad. So he's really getting into the whole digital nomad family and world schooling movement. And a quick background, Genki believes the future where more and more people will be nomads and world residents, including world schooling families, right, Neville?
Absolutely.
And their mission is to help us, all of us, stay healthy and live well wherever we go. And they're starting with worldwide health insurance made for digital nomads, and hopefully there'll be more will be happening in the future. And my kids and I, we've been traveling and world schooling for about 7 years. I've tried a different travel and health insurance policies. Years ago, when I was a young backpacker in the late 90s, I used World Nomads. But Genki is kind of a newer startup. They've been around for a couple of years, so I am eager to try them out. And as you guys know, I'm a digital nomad. I have a 12-week course on how to world school and travel extensively as a family. And I'm also trying out different affiliate marketing links. So I, as a world schooling and digital nomad family advocate, I really try to choose the ones that I hear that are great and curate them. So I did recently sign up with Genki to be, I guess, an affiliate. So I will put the link later on. If you click on it, it won't cost you anything, but they may send a couple of dollars my way. And I'm trying that also with Amazon affiliates, and they owe me 57 cents. So it's not going to be a great amount, but it will help. So please make sure to click on the link. So Neville, welcome so much. Welcome for coming. And thank you so much for taking time out of your busy day and meeting with us and explaining what you guys offer and explaining travel insurance, because it's so important. And I do know digital nomads and world schoolers who don't buy it when they travel. They take a big risk and they're willing to pay out of pocket for things. But then once in a while, unfortunately, accidents happen or illnesses happen and they're devastated. I have seen GoFundMes with, some families that have this, who take the risk and not get properly insured. So welcome. And if you could just let us know a little bit more about your background and your new kids. I don't know if you have one or two, but we'd love to hear about that.
Thank you, Liz, and thanks for having me. 2 kids, so I'm a dad twice over now. I have a 3-year-old and a 3-month-old. I'm originally from the States, from Washington, D.C. and the suburbs there, and currently based in Valencia in Spain, where my wife and I have been for the past few years. We had both of our kids here. Neither of us have any connection to Spain. We just chose it as a great place to live. And prior to that, I spent about 11 years up to now. Exactly, it'll be 11 years next week since I left the US originally and just started nomading around the world. It started as like a 6-month trip around the world to scratch a travel itch I'd had for a long time. And then 6 months became a year. And well, a decade later, here we are. And a little over 2 years ago, someone I know reached out to me and said, hey, I know you're a digital nomad and you've written a lot about it and like helped other people become nomads. And I know you're super plugged into that scene. And you also are, my background is in marketing and tech and digital marketing and websites and all that fun stuff. And so there's this company I want you to take a look at. I'm an investor and an advisor. Anyway, long story short, what I thought was going to be like, hey, can you give us some feedback on the pitch deck? Actually turned out to be, we need a co-founder who knows marketing and can help us grow this company. And so for the last 2 years or so, that's been my role, growing Genki from the initial first few members that the original team had gathered together when we first launched in September of 2021, up to now. I think we're over 15,000 or something like that, 17,000. Since then.
And it's a German company originally, or what is it?
Yeah, so my co-founder Mark is German and the company is legally headquartered in Germany, but we are a fully remote team. We work from all over the world. We are mostly nomads ourselves and of course remote workers. I've got colleagues who are based, who are like full-time travelers, and then some like myself who kind of slow mads who are in Mexico, Thailand, Georgia, all over Europe, sometimes in the States. But
Okay.
legally, the entity is based in Germany and in the EU, which is important for regulatory reasons.
Right, right. Yeah, we'll talk about that a little bit more because I talked to one of your colleagues. He's like, oh, you know, German laws, German rules. They're
Mhm.
very particular about that.
Yeah.
Awesome. So thank you for letting us know the origin story of Genki and how you got involved. So let's talk about the basics of travel insurance and international health insurance. I have interviewed the founder of Insured Nomads. It's a very high-end, expensive program if you want to be fully covered for everything. But it was somebody who's been in the industry for a while. So he did a really good job kind of explaining that. But I think we should mention it too. And I've also interviewed somebody at Safety Wings, you know, because they're a little bit more economical. I think you guys are in that ballpark too. And the last two of you,
Mhm.
Genki and Safety Wings, you guys really focus on digital nomads and world schooling families, or families and, you know, single people.
Mhm.
So let's just give a good overview of travel insurance and what is the difference between that and health insurance, because those of us from the US, we have very expensive health insurance, either through our companies, and sometimes it's fully covered, other times we have to chip in, or, you know, if we're an entrepreneur, I mean, we have to pay a lot of money for that. And then in other countries, people, you know, they pay high taxes, but they get, you know, healthcare as part of being a citizen. And so when they leave, when they deregister from their country, they can't take that with them. So
Mhm.
they have to purchase out of pocket some travel or international health insurance. So it is important because, as I mentioned, things do happen. I think most of us buy travel insurance and we're fine, but just in case, it's a good idea to have that. So let's talk about the difference between travel insurance and then international health insurance, or global health insurance, or expat health insurance. I think there's different
Mhm.
terminologies for that.
Sure, love to do that. And just for background, like I don't come from the insurance industry at all. Obviously now I'm steeped in it, but my background, as I said, is in marketing and tech. And as a user of these products, right? As a digital nomad, as someone who's been traveling, I was always on the other end of it and had to kind of sort through all this mess and figure it out myself. So I come from a little bit different perspective than say like Andrew, who's, you know, longtime insurance person. And I would say that there's sort of four types of insurance that we can talk about, and we'll drill deep into two of them. So first, there's your local health insurance, right? This is what most people are familiar with. If you're from the States, it's most likely private insurance, unless you're on Medicare or Medicaid. So it's private insurance that you pay for. And generally, you have full cover for all kinds of things, but typically every policy is different, but typically it's limited to the country that you live in, right? And maybe it covers you for some sort of like temporary stay overseas, but usually that cover is quite limited, both in terms of the length of time that you can be overseas and also like what exactly they'll cover, how long it's covered for, all of that stuff. So local insurance is fine if you only live in one place, but obviously we're all here because we want to explore the world, or, you know, spend time with our families in different countries and give them those experiences. So local insurance doesn't cut it for that.
Right.
The second type of insurance, you mentioned World Nomads. That's common, and that most of us who've traveled, or if you're like, you know, grandmother's been on a cruise, they usually sell travel insurance, right? Traditional travel insurance. And travel insurance is generally designed to cover your trip itself. So for example, if you prepaid for a bunch of bookings, you know, you spent whatever, $5,000 to book the cruise, and then something happens and now you have to cancel and they won't refund you. That's what travel insurance is really designed for. Often they include some cover for like lost bags or things like medical care, but the medical care is typically very limited, both again in terms of the length of the policy. So usually travel insurance is insuring you for a very specific period. You say, I'm leaving on Tuesday the 12th and I'll be back on whatever, the 30th, and they're covering you for just those days, and again for a very limited set of things. So again, if you're going on vacation or something like that, that's really what travel insurance is designed for. Okay,
And
with those two.
does Genki offer that?
No, we don't offer either of those. So
Oh,
those are traditional products that are designed not for nomads, but they come up often. So I just want to mention the two of those so everyone understands what they are. The two types of insurance that we'll go into more detail on that are, in our case, designed specifically for nomads, world schoolers, traveling families, and to some extent expats, are travel health insurance and international health insurance. And like anything in insurance is complicated, and there's a million different caveats and asterisks and details. So it's important to read the fine print of a policy, whatever company you choose. I'll talk about how we differ in terms of these two products at Genki at a high level. But again, if there's specific questions, we can address those, or we can take them offline. If you have questions about like your personal medical situation or something like that, you can certainly chat with our team over our website. So at a high level, the two concepts again are travel health insurance and international health insurance. Travel health insurance is health specific. So it's not covering your suitcase or your canceled flight or anything like that. It's covering your health, just like health insurance, but it's designed to cover you outside of where your health insurance normally covers you. So typically travel health insurance is intended to supplement your local health insurance. So maybe you have healthcare in the US, or you're European and you have a European health insurance, like a national health service, for example, and you have that covered, but again, it's limited to your home country. And now you're planning to spend 6 months in Bali. So what do you do? So that's where travel health insurance comes into play. And traditionally, the idea with travel health insurance was it just sort of patched you up to get you back home, right? So if you have, God forbid, some scooter accident or something like that, or you get malaria while you're traveling, the idea with travel health insurance was it would cover the medical bills for like the emergency, immediate treatment that you need wherever you are, and then oftentimes even include like the flight back if you needed to get medically transported back to your home country, or just cover you for some limited period of time until you could get back to your normal doctor and your regular insurance and all of that.
Right, but that means that we keep our insurance in our home countries, and sometimes we Americans, we quit a job, or we're working for ourselves and we stop paying those and we leave, or you're a European or other country where you deregister from your country, the tax system, you're gone for a year, so you're not getting that health care, and then when you come back, nothing's there to help you, right?
Exactly. And so our Genki Explorer travel health insurance is designed to fix some of those issues, but it's not a replacement for traditional health insurance. Again, it is a supplement. So where traditional travel insurance and travel health insurance are quite limited, with Genki Explorer, because we designed it specifically for nomads, we cover worldwide. So you don't have to tell us in advance which countries you're going to exactly or anything like that. And we cover you, it's a monthly subscription. So you just sign up online and pay every month, like, Netflix. And you can cancel anytime at the end of the current billing periods. You can say, hey, I'm moving back home, or I got local insurance or whatever, and cancel. And the way it works, it's worldwide cover, it's month to month, and it's for up to 2 years, a maximum of 2 years, which is much longer than traditional travel insurance or travel health insurance. Again, usually those last anywhere from something like 28 days up to maybe half a year or maximum a year. We can cover you for up to 2 years. And with Genki Explorer, it's not limited strictly to emergencies, as most travel health insurance is. It's just limited to anything that's medically necessary. And that's sort of a fine line difference. But an emergency, I think we all know, like you end up in the hospital, you have an accident, something that requires immediate treatment. And that's what most insurance covers. What we additionally cover is something like, I feel sick, I think I have the flu, I got an ear infection, something like that, especially if you're traveling with children, right? You never know, is it something that's more serious and needs attention now, or they're going to get better in a few days? You don't want to chance it, so you go to the doctor. That's medically necessary treatment. And those things would be covered in addition to, bona fide emergencies. All of that is under our Genki Explorer. What's not covered under Genki Explorer are a couple of things. One is any sort of preventive care. So for example, checkups, vaccinations, your mammograms, your routine visit to your doctor, cancer screenings, any of the kind of stuff that that you're either supposed to do at certain ages, or you just want to do kind of preventively to ensure you stay healthy, right? So like you're planning to travel, you're supposed to go get a vaccine before going to a certain country. That would not be covered under most travel health insurance and not under our Genki Explorer. The other really important thing is that 2-year limit. As I mentioned, it's much longer than a traditional travel health insurance, but at the same time, there is still a limit. And the reason why that matters is because if you were to develop some sort of chronic condition or something that requires ongoing treatment, during the time when you have that insurance. And then say you go back home, or just you hit the 2-year limit and your policy ends. The problem then is you no longer have cover for whatever that was. So God forbid, worst case scenario, which is what we think about in insurance, right? We buy it for the worst case scenarios. You develop, say, cancer or something like that while you're insured. Okay, during the time we cover cancer. So during the time that you have the insurance, you would be covered. But if you then said, okay, I'm moving back to my home country to, be close to friends and family who can help take care of me, or again, you just hit that 2-year limit, all of a sudden you no longer have coverage. And depending on your home country and your situation there, if you don't have any other insurance, they're also going to tell you, sorry, you have a pre-existing condition, or, in the case of Europe, like you haven't been paying into the tax system here, you're not covered anymore. So many of our members do travel with just travel health insurance, and we do offer extensive cover, but there is that additional risk there that when it ends, if you have something that happens to you during the time when you have it, you no longer have cover for that.
Okay,
And
but
if
can I
you,
ask you a quick
Mhm.
question?
Sure.
If you have a pre-existing condition and you get that type of insurance and start traveling
Mhm.
for 2 years, does
Mhm.
that get covered? Are there any screenings that you do before you accept a customer? What is the situation with that?
That's a really good question. And that ties into exactly what we were just talking about. So the reason why it's a problem, that the situation we just described, is because pre-existing conditions are not covered. They are excluded by all travel health insurance that I'm aware of, including ours. And that's part of the reason why it costs less, right? So if you have some sort of ongoing condition, if you're on dialysis, if you're taking insulin, or if you just have some, you had some injury a little while ago and you're still seeking treatment for it, all of that would be excluded under travel health insurance, right? It should be covered under whatever other insurance you have, but it would not be covered under travel health insurance. For our Genki Explorer, we have, I think, quite a generous definition by industry standards. You can compare them. For us, a pre-existing condition is anything that you sought medical treatment for within 6 months before signing up.
And
So
how do you know? I mean, because there's HIPAA laws, there's privacy laws. Like, do you have a questionnaire? Do you come and examine us? I mean, how does that work?
great question. So in the case of Genki Explorer, there is no medical questionnaire. You can sign up online. It's more or less instant. It takes about 2 minutes to sign up, and you have your certificate of insurance more or less the next day, but the insurance takes effect immediately when you sign up, or whatever day you choose if you're traveling in the future. There is no medical questionnaire, but at the time when you would go to file a claim, if you would say, hey, I went to this hospital and they billed me, $2,000 or euros or whatever it is, that's going to go through the claims process, and they're going to read the medical records that you provide and understand from that. And they may seek more information from the doctor or the hospital. You always sign a release when you file a claim to say, I authorize the transfer of my medical information. So that gets a bit into the weeds of how insurance works. But basically, at the time you sign up, there's no questionnaire. When you go file a claim, if you were seeking treatment for something that was a pre-existing condition, then that's when it would be, an issue.
Okay, so then your claims people will do the research, the forensic research, and
Yeah, and
figure out
that's
whether or not this is an ongoing chronic condition.
exactly. And it would be evident from like the doctor's own notes and things like that. And obviously in insurance, unfortunately, you have to deal with fraud. I'm sure that wouldn't be an issue with anyone here, but it's the kind of thing we have to watch out for, where someone has, in a pre-existing condition, and then they go sign up for some, and they're not covered, and then they go sign up for some new insurance, and they're basically paying one day of the premium and then trying to claim some $10,000 medical bill, which of course drives everyone else's costs up.
Right.
So we have to watch out for things like that. But the main points, again, to remember, there is no medical questionnaire, and you're not prevented from having the insurance. This is important. If you have a pre-existing condition, you are not excluded, right? The condition is excluded. So you are covered. It's just that if you had treatment for a thing, for some medical condition within the 6 months prior, just additional treatment for that condition is the thing that's excluded as a pre-existing condition.
Okay, but if you had an accident or another illness that just pops up, that would be included.
Exactly. And we've had some complex cases where someone had, like asthma a long time ago, and then it flared up again and things like that. And again, like everyone's individual medical situation is different. So if you have a very specific question, if you know you have a pre-existing condition and you want to understand the nuance, please get in touch. But even in situations like that, things have been covered where it was considered not a continuing treatment, but it was like a new treatment for something that had happened a long time ago, for example.
Okay, and then if you're healthy and you start traveling, no pre-existing conditions, and then all of a sudden, God forbid, you get cancer,
Mhm.
You cover that for a little while, but not forever because you have that 2-year limit, right?
Exactly. Yeah, it's not an arbitrary little while. We cover it fully. And something else that's really important with Genki, and we mentioned being based in and registered in Europe and falling under the German, and in the case of Genki Explorer, also French insurance laws, because the risk carrier is Allianz Partners, who's a French subsidiary of Allianz.
Okay.
So with that, the way our insurance works, there is no maximum cover limit. If you've purchased travel insurance before, or as I said, if you had something like a credit card that gave you some amount of insurance cover when you book a trip with them or something like that, if you read the fine print, you'll find that there's often limits, and they sound like a lot, like a few $1,000s or something sounds like a lot of money. But if you've ever had, like a significant medical bill, like we're talking about cancer as an extreme example, but even just a trip to the emergency room, you can quickly go over that. With Genki Explorer, again, being with both of our insurances being based in Europe, and the way that we set up the insurance and the way the regulatory framework works here, there is no limit. There is no medical cost limit. It's covered. So if you get cancer, again, God forbid you get cancer while you have our insurance, your treatment is covered. The problem is that at some point you may still need treatment, but no longer have our insurance because either you've moved back home or you've hit that 2-year limit.
Okay. Yeah. What do you recommend for people who do have a pre-existing condition that they want covered?
It's complicated. So all of this kind of points to it sort of begs the question of like, yeah, what do you do in all of these situations? So I mentioned Genki Explorer. That's our travel health insurance. That was one of the types of insurance we talked about. The other type of insurance that exists is called international health insurance. I think you referred to it as global health insurance. You might also hear it called international private medical insurance, which is a mouthful, sometimes shortened to IPMI. These are all different names for the same thing. I hate that they all sound exactly the same and it's very confusing. We call ours, again, Genki Explorer, the first one I talked about. And the second one we offer is called Genki Resident. And the way Genki Resident works, it's international health insurance. There is no age limit. So you can sign up anywhere from the day you're born through the rest of your life. We can cover someone for the rest of their life. And there is no maximum policy length. So it's an annual policy. So there's a 1-year minimum, and then it renews monthly after the first year. And it can cover you, again, lifelong. So in the case of things like in situations where you don't have any other health insurance, like what we talked about, you sign off of the home system, you stop paying your taxes in Germany, or you tell Cigna or whoever in the US, United Healthcare, hey, I don't want to pay you guys the $2,300 a month anymore, or you go off and become a freelancer and your old job doesn't give you insurance anymore, anything like that. Any situation where you're no longer covered in your home country, what I always recommend is that you go with international health insurance. It is more expensive because it covers a lot more, right? So international health insurance can cover pre-existing conditions. There is a medical questionnaire at sign up. So when you sign up, you will get asked a series of questions. It's not a physical exam. You don't have to go to a doctor. It's just a form you fill out online. But based on that, you will either get approval, like, yeah, you have this pre-existing condition, but no big deal. That's fine. It's covered. Or in some cases, we can't cover a person because they already have some really expensive condition. And so we can't cover that, which is why it's important. If you're young, especially, and healthy, sign up for insurance now, and then you can just keep renewing it, as opposed to trying to get the insurance once you have some expensive condition that obviously no insurer wants to cover if you already have it. So there's a medical questionnaire. Again, you might get, hey, no problem, you're covered exactly as we described. You might get, sorry, we can't cover you, or you might get, okay, we can cover you, but there's some exception or some additional cost if you want to cover this. So it gets more individual when you're dealing with international health insurance. Our travel health is more one size fits all. International health insurance, like you will have a sign up process, and you will have an approval and that medical questionnaire that we talked about.
Yeah, and very personalized. So that cost depends also on your age. Yes.
Yes, in all cases, the cost depends on your age. Normally, the cost depends on the region that you're going to. So again, traditional insurance companies ask you, give us exactly how many days are you going to be in Thailand or Medellin, Colombia, or wherever you're going. We cover you worldwide, and we give you a price that's worldwide. The only exception to that is because healthcare costs so much more in the US and Canada, we give you the option to say, I'm not in the US and Canada. I don't want to pay for cover there because it's so much more expensive. So you can exclude the US and Canada from your cover and pay about half as much by doing that. And then if you do plan to travel there, you can actually add that later. So you can get in touch with our customer service and say, oh, you know, I just spent whatever 2 years traveling and now I'm going to the US for a month. Can I add US cover for the next month? And we can do
Great
that.
to know. Okay, because then I wanted to, people are going to be gone for 9, 10, 11 months, and then they do want to go home to the States or Canada for a month, and they can contact you before going and add that and pay the extra that month, and then go down to the cheaper plan after they leave. That is a really good benefit, because I think a lot of people ask, if they're Americans, if they leave, give up their travel insurance, and then, go back to the States, and it does take time to get on that, annual Obamacare, whatever it is,
Yeah, there's a once
sign
a
up.
year enrollment window.
Exactly. So if they decide to come back, they can use yours. Okay, good to know. Well, okay, this is information. Did you want to continue?
Yeah, there's a really important point I just wanted to mention that you brought up. So travel to the US is one thing because the US is expensive, but there's another situation that you're describing, which is home country cover, right? So if you're Chinese and you go to the US, it's simple. You need US cover. But if you're from the US and that's your home country, as defined by where your passport is from, where you would go back to in case of an emergency, where you normally have residence, where you have a right to live there, you always have to specify when signing up for either type of insurance, your home country. And cover in your home country is limited. In the case of our Genki Explorer, it's limited to 6 weeks every half year, which is pretty generous. So you could spend over a month, about a month and a half, almost 42 days every 6 months in your home country. And that could be the US or it could be somewhere else if you're from somewhere else.
That first policy covers the US for 6 weeks.
Yeah. So again, there's two concepts that we're intersecting. One is the US and one is your home country. If everyone listening is from the US, then you would need to keep both of those in mind, right? Covering your home country and having US coverage.
Right.
In the case of Genki Resident, our international health insurance, you can be covered in your home country for up to 6 months. And this is super relevant for world schooling families because I know a lot of people do a split like that, where they spend a significant amount of time at home with the grandparents or because of work. And then depending on the seasons or job opportunities or whatever's going on, then spend the other 6 months traveling. So with our Genki Explorer, you would not be covered for that full 6 months in your home country with the travel health insurance. But again, the presumption there is that you have some other cover in your home country. If you don't, then again, international health insurance or Genki Resident can cover you for those up to 6 months in your home country, including in the US.
Yeah. Super complicated, but it's really important. This is why I interview experts like you to explain it all. And yeah, because like I said, if we don't get the right policy and something happens, then again, we might be like posting GoFundMe's, to pay for everything. Okay, great. So this is, let's talk a little bit more about Genki, more specifically. What do you feel like are your features and benefits of your two programs or you said 2 or 3, but the main 2 that are appropriate for world schooling digital nomad families compared to other, companies out there?
So again, yeah, we have 2. We have Genki Explorer and Genki Resident, but Resident has an additional option, Premium, where you can also cover preventive care like checkups and vaccinations, and there's also additional cover for additional treatments that are or additional cover for things like dental care, dental cleaning, vision. We additionally cover even something like laser eye surgery can be covered. There's a waiting period for some of these benefits, but with the premium, it's all kinds of things. And then both versions also cover things like traditional Chinese medicine, acupuncture, osteopathy, massage, if it's prescribed, physical therapy. So the premium version of Resident is really comprehensive in terms of what it adds. As far as some of the advantages of Genki, so relevant for me, and I think a lot of families, we cover many more sports than most other insurance companies. Most insurance companies basically give you a list of sports that are covered and everything else is excluded. We tell you basically everything is covered. In the case of Genki Explorer, everything is covered except for a handful of the most dangerous sports like motorcycle racing, parachuting, skydiving, and two that are important that do come up that I wish we could cover. Certain climbing, there are some limits around climbing, and diving is not covered, which is unfortunate because I know that's something a lot of people like doing, but apparently there's been a lot of fraud in the past, not with us directly, but in the insurance world around scuba diving and stuff like that. So it's something we're working on getting covered there. With our Genki resident policy, all sports are covered, even the crazy dangerous ones, even base jumping and skydiving and all of that stuff. Every sport is covered as long as you're not a professional athlete getting paid to do it, right? Then you need special insurance for that. But if you're with your family, if you're going rock climbing or base jumping or any of the stuff you like doing, or your kids, of course, are participating in sports, if you're skiing, snowboarding, kite surfing, any of that kind of stuff that's popular among the Nomad community, all of that is covered. Something else I mentioned earlier, but that's very important, definitely read the fine print on any insurance. There is no maximum limit for necessary medical treatment. So we don't tell you, oh, well, the hospital sent you a bill for $1 million because you had this crazy surgery and you have insurance for up to 25,000. Here's your 25,000. Good luck with the rest. It's covered. If it's medically necessary and it's a legitimate bill, it's covered. We don't restrict you to like a specific provider list. So those of us from the States, we're used to going, you have a medical issue. The first thing you do is go to your insurance website or app and say, which doctor am I allowed to see? I need a dermatologist. Which dermatologists are in network? We don't have any concept like that. You can go see any doctor, any hospital in the world, and they're covered as long as they're locally licensed, right? As long as they are legally allowed to practice medicine in whatever country you're in, it's covered. There's no limit on who you can see. In case you have an emergency, we have a 24/7 emergency assistance line. Again, this is applicable to everything I'm talking about now is applicable to both Genki Explorer and Genki Resident. And this is super important. This is something I didn't really understand until I got into the industry. So when you're traveling, in the US, as messed up as our medical system can be, there is still this idea that hospitals are legally required to treat you. They might send you a gigantic bill that's like 10 years worth of your salary at the end of it, but they are legally required to treat you and then figure out the billing. This is true in parts of Europe, but it's not true all over the world. And so what can happen is if you have an accident or an emergency and you end up in a hospital in certain countries, they can refuse to treat you until they have some sort of assurance or proof or cash in hand that they know that you can pay them. And they don't want basically, people who have no money or rich foreigners coming and then saying, oh, well, I'm only in this country for a short time. I'm going to, get the treatment. And then what's their recourse, right? How are they ever going to find me? How are they ever going to get the money? So it's unfortunate, but it happens that you have hospitals and doctors who will refuse treatment until you basically prove that you can pay them. And so when you have our insurance, you not only have the 24/7 emergency assistance line, but they'll also do 3 things that will help you in that situation. One, they will set up direct billing with the hospital. So in the case of an emergency like that, where you have inpatient treatment in a hospital, which is usually the most expensive care that you could have, you're not paying out of pocket and then getting reimbursed. In that case, the emergency assistance is getting the bill directly from the hospital and sending it straight to the insurance company. So you don't even have to worry about the bill. The second thing that they're doing, that most important, actually, first thing that they're doing, but second on my list, is they are guaranteeing payment to the hospital. So even before there is a bill, they're saying, go ahead and start treatment, take care of this person immediately. We guarantee you that we will pay. And they can do this with hospitals in every country in the world. They have relationships and they've done this. So they specialize in this. This is an emergency assistance team that we contract with. That's all they do all day, 24/7. And then the last thing that they do is they monitor the standard of your care. So wherever you are, if you're in a hospital, maybe you're in a country that doesn't necessarily have the greatest medical system, or you're just somewhere that's a little bit more remote, they will make sure that whatever care you're getting is up to, in our case, we hold things to a European standard, basically the level of care that you need, right? And if not, they can arrange to have you medically transported. If you're going to be in hospital for some amount of time, more than a few days, they can fly out a family member to be with you. So the way I like to think of it is that I know we talked about the different types of insurance at a technical level, but at a more human level, there's like the type of insurance that gives you a piece of paper that you can show when you apply for a visa, but you really hope you never have to use it. And then there's insurance that like will actually help you if you need it in a medical emergency or in any kind of situation like that. And obviously we offer the second type.
Okay, sounds good. Yeah, again, I kind of looked at your Trustpilot reviews. They're really positive. Andrew Jernigan did say when you look at reviews, look at the claims process comments, not just the sales process, because everyone sounds great. So I think that's important to know. I'm going to invite the people who are watching live to ask Neville questions, but I have a couple more. What about COVID? Because COVID's kind of waning. I know that some insurance companies, travel insurance, did cover COVID before, but now it's like we're warned, like you're warned to either get vaccinated or stay away or whatever. Do you guys cover that in case one of us wasn't vaccinated, or even maybe we were vaccinated and some new strain comes and we're sick and need to go to the hospital for that?
Yep, we cover you for COVID treatment regardless of whether you're vaccinated or not. The thing to be aware of here is that, when you hear like COVID coverage from insurance, a lot of times what people are looking for cover for is something like if, there's a lockdown or someone tests positive and they can't travel, and then they've already booked their plane reservation and then it's canceled. So that's not the type of cover that we offer, right? That's trip cancellation or something like that. We're specifically focused on medical care. And again, we cover anything that's medically necessary, be it COVID, malaria, cancer, scooter accidents. That's a really common one, unfortunately, for nomads who are traveling. As you know, if you spend time in parts of Southeast Asia, parts of South America, it's a common way to get around. Lots of people have accidents. Unfortunately, they don't always have helmets. They don't always have the right license. Other insurance companies will exclude you for those reasons. Obviously, I recommend wearing a helmet, but you're covered with us either way. As long as you're not driving drunk. We do not cover if you're drunk driving or under the influence of drugs. But if you're honest,
yeah, I have rented scooters in Bali and Thailand and a few other places. And, my kids, they were 7.5 when we started traveling. So I had one in the front, one in the back. We always wore helmets. The rental company, I would rent them for a month for like $100. They didn't often have kid helmets, so I would go buy them. But there was a couple scary times when we were in a rainstorm and I'm driving and it's slippery, and we were fine. But I have a friend who doesn't have kids or anything, but he did die in an accident in Thailand on a windy mountain road. And and I've heard so many people who get injured. You see backpackers and digital nomads all the time with the little scrape marks on their legs. I mean, you don't want a scooter to fall on you and your kids. It is dangerous. And I did it because I used to own a scooter years ago. I'm a good driver, right? With that. But I would really recommend people to think about using that mode of transportation if they're not experienced or if they're not good drivers, and definitely get helmets, and definitely think about, maybe wearing long pants in case you do fall, Anyway, that's another thing. But yeah, and I wanted to mention also, you were mentioning medical or dental benefits. My kids and I, we've gotten our teeth cleaned in many countries around the world and had excellent treatment, and that we just paid out of pocket $20, $30, $40 per person per cleaning. So that's what we have done. If we have travel insurance that doesn't cover dental, we just go to places around the world where it's really affordable. I am trying to figure out where can I go for 6 months where it's economical and they do a good job doing braces, because one of my daughters has a slight overbite and it won't take forever. But that doesn't travel insurance, and these type of, I don't think your insurance covers that. So that's out of pocket. Okay, great. Let me just check to see if anyone has any questions, guys. Ask, and also we're streaming this live in my Facebook group, Worldschooling, Digital Nomad, Trailblazing Families. So write in the chat if you are watching the replay, and then I think, Neville, you're a member of it, so you can hopefully come later, and we will repost this on YouTube later. But yeah, so again, this is really important. And it's really hard to read all the fine print and figure out which is the best for the company. Can you try to kind of give some rough estimates of costs? Like, say it's a family of 4, mom and dad and 2 kids. I mean, you're a family of 4. And, like roughly what it would cost for the Travel Explorer one, and then your more comprehensive one.
Yep. So our Genki Explorer starts at 39.30 euros per month. And that's for the lowest age group, which is 0 to 29. And then it goes up a bit every age bracket over that, like 30 to 39, 40 to 49, and so on. But we do cover, you mentioned also like benefits for families, just continue on that thought for a second. We do cover from age 0, which is not always the case. So again, like if you have in my case, I've had 2 kids now in not my home country. Both products offer varying levels of pregnancy cover. Again, if you're planning to have kids and you sign up before you're pregnant, we can cover pregnancy under Genki Explorer. And then there's even more comprehensive cover around pregnancy and delivery and all of that under Genki Resident, the international health insurance. So that's something to think about too. I know I'm in a Facebook thread from like years that just keeps going about like experiences families have had having babies in other countries. And so that's a big thing, something to consider. And again, make sure that if you're doing that, make sure you also have insurance where you can actually be covered from the beginning. Even if it's like some insurance will only cover your child after some days after birth, which doesn't sound like a lot, but if you think about it, you're most likely to have issues, hopefully not, during and immediately after delivery, right? All the neonatal stuff. So you want to make sure that you can cover a child if you're pregnant or planning a family or planning children, more children, that they can be covered immediately from birth, and we can cover them. In terms of the price for Genki Resident, the long-term insurance, it starts at €100 a month, but there really, as I said, like a lot more options and personalization there in terms of both the deductible and then obviously depending on the age. But yeah, it's both plans. Each person has their own insurance. So it's not necessarily like a family plan per se, where you have everybody under, you can sign up everybody at once, but you have a price and full insurance contract for each person who's on the plan.
Okay, so again, 39 for the travel thing, and then I'm sure it'll be much higher for the adult. So, I mean, what are we looking at for that plan for a family of four? Like $200 a month, $100 a month?
So if on the Explorer plan, as I said, starting at $39.30. So if the parents are a little bit older and the children are anywhere from 0 to 29, as I mentioned, something in that €200 a month range. On Genki Resident, it starts at 100, in same age brackets. And then, for example, if you were 50 years old, as an individual, your insurance would be $255 a month, and then depending on the kids' ages, there could be 100 additional for each of the kids. So you'd be looking at something between, again, depending on the options you choose for a family of four, something between 500 and €1,000 a month for the full international health insurance, which is the one that's designed to replace what you might have in your home country.
Yeah. And again, I know for some people who live in Germany or other places where they're not used to paying it, it's a lot. But again, if you deregister from your country, you'll also not be paying taxes. So then you can divert that money into paying your own insurance, right? And then for some of us Americans who are self-employed, that's like, oh, that's not bad. I mean, because you hear of some Americans who have to pay thousands and thousands a month for private insurance if they don't work for a big corporation. So,
oh yeah, I just happened to read an article just the other day on the. I'll pull it up while we're talking.
Okay.
Sorry.
And yeah, so this is again, unfortunately, it is the cost is just a cost of living in our modern world and needing, to be covered if God forbid something happens. So I think Genki, again, I've done a little research. I've heard other digital nomads talking about it. This is why I wanted us to, collaborate a little bit and, share, because you're a little bit newer than some of the other ones. And what other things do you guys have planned? Because you kind of hinted at you're starting with health insurance for nomads. Are there other products or services that you are hoping to offer us in the future? Any added value kind of stuff?
Yeah, so we talked a little bit about this, and you asked about the origin story of Genki. I told you, how I joined the company, but the actual initial sort of genesis of the idea for Genki was my co-founder, Mark, himself about 5 years ago became a nomad, started traveling the world, and realized that basically we have all this technology and all of these things now that make this lifestyle possible, from mobile internet to our laptops, Zoom, right? We're having this conversation now in different countries, online banking, like so many things that we didn't have just a few years ago, which now make it possible. Online schools, to live and work all over the world. But the thing that wasn't easy to do wherever you go in the world was take care of your health. And he experienced that firsthand, and I experienced that firsthand. So when we first met and talked, it totally resonated. I mean, since the time I became a nomad, I've had 2 kids. I had 5 surgeries. I messed up a knee, another knee, skiing, skateboarding. Like I've been through it all. And every time I had something like that, it was always a thing that forced me to sort of like sideline my travel, go back home, go to the US. And when I was younger and I first started, I had some cover like what you mentioned when you were backpacking, but it really wasn't like proper health cover. It was like worst case scenario. So anytime I actually did like a physical or went to the dentist or anything, it was always like I just saved all that stuff up for whenever I go home and visit my parents. And as you
Okay.
mentioned at the outset, like our vision is a world where more and more people, especially families like ours, are able to travel and live and just live all over the world and not sacrifice what you have at home, right? When you and I started, that was sort of the deal, is that you had to kind of sacrifice taking care of yourself and normal life and all of this, but you got to have all these great experiences. And now what we're saying is you can have kids, you can have a family, you can educate your kids and create these amazing experiences for them all over the world. And the bit that we're adding to that is, and take great care of your health wherever you go, not just have a piece of paper that says in theory you're covered in an emergency, but actually go get preventive care, get the mammogram, have another baby and have that be covered. Do the cancer screenings, get vaccinations, like actually proactively take care of your health and have full cover in case of emergencies, or as I mentioned, just anything medically necessary. That's where we are today. As you saw, insurance is complicated. It's taken us a long time to get where we are. We're a startup and we always want to move faster, but we're constantly iterating within the world of insurance, which moves very slowly. So it's taken a while to get to where we are now and launch those 2 insurance products that we have. But the full vision is actually to be a health partner for nomads and expats and world schooling families, and to not only be there if something goes wrong, but to also help you proactively stay healthy, whether that's exercise, nutrition, diet, finding healthy places to go, and just taking care of your health wherever you go in the world. So I can't get into like exact products just yet, but that's the vision. That's the direction we're going with the company.
Okay, and what would be nice is if you guys could come up with a database of English-speaking doctors or whatever around the world, because sometimes I have to go into those Facebook expat groups and dig through there. I mean, it's a common question. Anyone can recommend an English-speaking pediatrician or a chiropractor or whatever. So that would be great if you had a database. And sometimes I do find a database. For example, I was in Bulgaria or something, and I found like that country's, I don't know if it was private or public, a database, and I could put in there English,
Yep.
it would give me the results, and I could say English speaking and then the
Yep.
specialty. So that was really helpful. And then I could book an appointment through that service, which was nice. So those kind of things I think would be helpful because, when we're going to a country, it's just hard to do all the research in advance,
For sure.
before or while we're there, of who is the best person to talk to. So I would suggest that one.
I
Um,
love I love that. A couple of quick points on that. So in that spirit, we have our Genki guide, which is not very medical specific, but more general, but with some health focus. Guide to popular digital nomad destinations, also a guide to choosing the right kind of health insurance. A lot of the points we just talked about, that's on our website. It's genki.world. You can also find all the information about both the insurance products. We try to make it very simple to sign up. It only takes a few minutes. We don't make you choose all of this stuff at once. We kind of ask you the questions in a very easy to follow way and try to explain it in plain English. One of the benefits, since you mentioned all of that, I'll talk about it. One of the benefits that we're in the process of launching, this is live already for Genki Resident, the international health insurance, and it's coming soon for Genki Explorer. It's a partnership with a company called Air Doctor. And what Air Doctor does is it's an app that you can download on your phone or a website you can use on your computer. And it's exactly what you said. You can search wherever you are in the world. They have cover in most countries. You can search for a local doctor or a doctor who does telemedicine, who can do an appointment stuck over a Zoom. You can filter by language and by specialty. So you can say, I need a Russian-speaking pediatrician or an English-speaking general practitioner or whatever you need, wherever you are. Again, they're not in every country in the world, but they're in most countries in the world. And with the integration that we have with them, the beautiful part of it is you can book an appointment through the app. You don't need to pay anything when you go to the appointment, and you don't need to file a claim later. They send the bill straight to us, and the insurance takes care of the bill. And it makes it really easy because, again, you can find English or whatever language speaking doctors and book the appointment directly on the website. And for me personally now, I didn't use it much before, but now as a dad, my favorite thing ever is telemedicine. because the last place I want to go is like the pediatrician's office where everybody already has a cold and they're sick. And I swear we get sick every time we go there. So for anything like, unless it's clearly like a 9/11 emergency, 911 emergency, the first thing that I do is telemedicine. Hey, doc, can you look at this? What do you think? And I still get the peace of mind of like, I didn't ignore the thing. And they can tell me, yeah, come in, come see like a, a doctor, come see, go to the urgent care, or yeah, it looks fine. Call me again in 2 days if it doesn't clear up. And like having telemedicine as an additional thing, especially as a parent, I think is just great.
Absolutely. I have one on Thursday with my daughter instead of driving an hour and a half in traffic to go somewhere. Awesome.
Exactly.
Okay, lots of great information. As I mentioned, I have a link if some people want to click on it and go to the website and find more information and contact your customer support people. Again, we don't have any exclusive agreement, but I am trying to curate really good world schooling digital nomad service providers. And I think Genki's one of them. So please click that link and check them out. And again, I hope in the content that you said you have that a lot of advice that you can also put on there if people are just starting out on in world schooling and being a digital nomad family. They contact me because I have a very well liked and super comprehensive 12-week course. It's super comprehensive. It's not an introduction to world schooling. It's like gigantic. 50+ hours of video content and lots of resources. So, and then I interview people, experts like yourself a lot and put them in my free group and all of that. So reach out to me if you guys are have questions, especially about education and traveling with kids, because I think a lot of digital nomads, they're used to traveling as a single person or as a couple, but then once you start having kids, things change. And so I can, show people the way, all the tips and tricks that works for me. So, all right, Neville, thank you so much. This has been a really great conversation. We have people watching, but they're being very quiet today. So I hope later on in the replay, when people watch, they can ask you questions, and hopefully later on you can come back and answer them. Sound good?
Happy to. Thanks again, Liz, for having me. Again, click the link in under the video and come to the website. If you have specific questions that you don't necessarily want to get into here because they're medical or whatever, you can talk to our team. You can chat on our website. Also for Genki resident, as I said, it's a little bit complicated. We totally understand insurance is like that. We do our best to simplify it. You can also schedule a call with one of my colleagues. They can do a consultation and walk you through which insurance might be right for you. There's no pressure. It's not very salesy. They're just ask you about your situation and make you some recommendations. And of course, go and get quotes from multiple companies, compare your options, look out for all the things that we talked about.
Exactly. It is complicated, and I recommend people create a spreadsheet or a list or something and write it all down.
Yep.
Thank you, Neville.
Thanks, Liz. Take care.
Hey, thanks for watching. I'm Lizz Quain. My twins and I have been traveling and world schooling for about 7 years, and I'm happy to share our experiences. Make sure to check out all the other videos on my channel. I have a playlist of interviews of fascinating world school families and service providers who share lots of info and wisdom about world schooling, traveling, and the digital nomad family lifestyle. If you're new to world schooling or have recently launched and are struggling because you're kind of winging it, if you need some help, I do have a super comprehensive 12-week program on how to world school and travel extensively as a family. I share lots of info on travel logistics, where to go, how to find community, how to immerse yourself into local cultures, and the variety of ways to educate your kids while traveling above and beyond homeschooling them yourself, and much, much more. Make sure to watch my free 2-hour masterclass on how to become a world schooling trailblazing family. That is a great way to learn how to get started. I'll include a link in the description with more info. Thanks and happy trails.